Good afternoon. Welcome to the St. Clair County EMA office, where we're bringing you a update. We're planning on doing these at least once a month, just to keep everybody informed of what's going on post-pandemic. Any information that maybe came up. I'm joined here today with the St. Clair County Board Chairman Mark Kern, and Chairman, it's a good idea you had coming up where we can kind of keep our citizens informed of the what's going on in the current world of St. Clair County. And today we're going to have a special guest with us.
Yeah, Herb, we talk about long haul symptoms for people who've gotten COVID, but the one thing that is with, I think, all of us really is we need to be aware of mental health issues. And that's why today we're joined by our friend, member of Team St. Clair, Dana Rosenzweig from St. Clair County Mental Health, to kind of, Dana, give us an update on where we are now and how maybe your services have changed during this pandemic. So
Sure.
Welcome.
Well, thank you. I'm pleased to have the opportunity to be with you again. As the chairman indicated, mental health took on improved significance during the pandemic. I think that early on we heard in 2021 that the rate of anxiety and depression was up by 25%. And that was not only in St. Clair County, that was a global increase in anxiety and depression. So those were some symptoms that were identified as being relevant to COVID. The major explanation for it, that was unprecedented stress. And I think it was unprecedented stress for our generation, really. We had never experienced a phenomenon like this that had such an impact on mental health, and it really played out. You had social isolation, you had people's ability to work was curtailed, they didn't get support from loved ones because of some of that isolation, and they couldn't engage in their communities. And I think that was a big part of it in terms of support people got from interacting with their communities. That wasn't available, and mental health suffered as a result. The other emotions that were involved in it, obviously, and we can all relate to these: loneliness, fear of infection, grief and bereavement, financial worries. These all contributed to anxiety and depression as well. Another phenomenon that I thought was interesting as I did some research, and certainly relevant to this group, is that the mental health of the healthcare workers was even more significantly impacted because of the sheer exhaustion that they were under. And so their mental health, as well as increased rate in suicidal thinking, was actually impacted by COVID rather significantly.
So are there age brackets that were more affected? Are there segments of our population that perhaps were affected more by COVID with mental health issues than others?
That's a good segue. That was next to my remarks, so thank you. Yes, there were other segments that were disproportionately affected as a result of COVID with regard to their mental health. We know that one statistic that came out that was fairly alarming, probably in the summer of 2021, was that 25% of people between ages 18 and 25 contemplated suicide. And if you think of that, that's a staggering statistic, 1 in 4. And so at that point, we knew that we were really under the gun in terms of the impact that this was causing and the behavioral impact that it had. Some other statistics from CDC on that is that those people who had pre-existing health conditions, they had a disproportionate amount of mental health conditions as well as women. We know that women and seniors, women especially because some of the increased childcare responsibilities because schools were closed, seniors because of the isolation. So those were populations that were definitely impacted more so than the general population. By the end of 2021, things stabilized a little bit, and we're hoping now that people can get treatment for not only existing conditions, pre-existing conditions, but for new conditions that resulted as a result of the pandemic.
So I know drug use, there are statistics about drug use and COVID's effect on people's addictions. Do you have any statistics that tell us about maybe overdose deaths issues that were caused in the county?
We do, and I want to talk a little bit later about suicide, but the data that comes from the coroner's office, Coroner Calvin Dye and his staff are really good about getting us timely information, and we track deaths by suicide as well as overdose deaths. And one thing that occurred that was somewhat encouraging in 2021, our overdose rate actually decreased from a previous record of 91 in 2020 down to 82 in 2021. And this is at a time when the rest of the overdose deaths across the country, our neighbors in Madison, higher. So the fact that we were lower in deaths, I think, was very significant. And I think it speaks to some of the intervention efforts that we had in the county that were available. The Mental Health Board made available funds to Chestnut for their medicated assisted treatment. Comprehensive Behavioral Health in East St. Louis stepped up their treatment services. So I think overall we saw the impact of the availability of treatment for people, and they also improved the access to care. People were able to be seen virtually. They were able to get medication to folks throughout the pandemic. So I think our response from a drug treatment perspective was excellent.
And the programs that you instituted during this time, some of those were funded by grant funding, special funding through
Yes.
COVID. Will they continue? Will those programs continue?
They will, and as a matter of fact, one special program that we continued, and the Mental Health Board's objective is to fund those programs that don't have state funds available or represent an extraordinary local need. And last year we were able to provide funding for the HeartLinks Grief Center, Diana Cuddyback, the director who was here before, to do additional grief and bereavement counseling. What we found out during the pandemic, early on people didn't have the opportunity to bereave. Funeral services were limited, and we know what that was like. And so as this has played out, some of this grief has had a residual effect that just is now getting addressed. So we need counseling, we need services to deal with that. Last year, the Mental Health Board provided a grant for HeartLinks to do that. This year, we have decided that need has not been completely met. It continues. And so we're going to provide services for extended grief and bereavement counseling through the HeartLinks program. And they do a phenomenal job.
How about kids? Are there programs out there for youth that are seeing some issues because of either school being canceled and being isolated, or other effects of that 2 years that we all spent together?
2 years, definitely. And what we're finding out is from our agencies that go into schools, Chestnut Health Systems, Big Brothers Big Sisters, Violence Prevention Center, to name a few, they're finding they're getting record number of referrals from the social workers in schools because of the problems that children are exhibiting. We're doing some youth mental health first aid through the Regional Office of Education to educate teachers as to be aware of mental health problems that are created and how they can address them. But I think it's going to be a long haul in addressing the children's mental health needs. I think we're going to be seeing this for quite some time.
So you have done some great work during the past couple of years. You did a lot of great work before that.
Well, thank you.
But really, you know, St. Clair County Mental Health and the Health Board all rose to the challenge. Let's talk about some things that came out of this that are positive.
Okay, great. Well, thank you, because there are some positive things that came out of the pandemic. One of the ones that I think we're looking to address mental health as a public health emergency. And I think as a country, we need to get comfortable with that. We know the prevalence of mental health. We know it is a public health issue. And I think the more we can bring that to the forefront, more funding follows it, and that's better. We also got people who could access services virtually. We actually had an ability to provide psychiatry more quickly to people because it could be done virtually. So moving forward, we have this hybrid, this blend of services, because you still need services in person for some folks, but there are some people that can benefit from virtual services, and we're more efficient because we can deliver them virtually. So that's been a good thing. We have state funding. Some rates have increased. The state has stepped up and has made more resources available. That's been a positive thing. I think they recognize the need for mental health. We have improved coordination through our mental health centers, through Chestnut and Comprehensive with our 3 area hospitals. I think people are working together more collaborative. That's a good thing. So I think there's some positive things that we take away from the pandemic. I think it makes us stronger as a system as we move forward.
So people that are viewing today, if they feel they may have a problem or know someone that has a problem, what's the contact information that they can get a hold of the services they need?
Okay. Well, the first number we always want to make sure that people know is the suicide hotline. So if you're ever at a point where you have suicidal ideation, you need to talk to someone, 1-800-273-8255. That's the National Suicide Hotline. That's answered within seconds, and they'll route you to resources that are available in the community. We had talked earlier that will be replaced in July by the new 3-digit 988 number, which we're anticipating. Other than that, locally, we want you to call Chestnut Health Systems at 618-877-4420, and Comprehensive Behavioral Health at area code 618-482-4440.
Testing.
Yes, yes. I had to think of the last one.
You don't have brain fog.
Well, that's interesting because somewhere in my notes, one of the things, there's a new neuropsychiatric condition that's been identified since COVID, and it's some confusion, some depression, some PTSD-like symptoms. So we're going to have a new diagnostic category of a mental health disorder that has its origins in COVID, unfortunately.
And is the thought that will have to be treated with medicine as opposed to with psychiatry?
Yeah, I think a combination of medication and talk therapy, because a lot of the symptoms that people have, it's the continued anxiety and depression. So you have to be medicated, and then you have to work on some of the other things through talk therapy. So and hopefully our system will be able to react to that.
Wow. So Dana, we want to thank you for a crucial part of Team St. Clair that St. Clair County Mental Health was. I'm sure we'll have to come back because it seems to me that these issues are going to be ongoing for a long time.
Yes, and I especially would like to come back and talk about suicide prevention initiatives that we have. And so one thing that came out of the pandemic was the increased rate of suicides. And in St. Clair County, unfortunately, we tied a record in 2021 with 37 deaths by suicide. However, that continues to be below state and national numbers. So we do have some encouraging statistics with regard to deaths by suicide, and we really have robust programming. And I'd certainly like the opportunity to talk about that and of our community walk that's coming up October 15th, which is Out of the Darkness, which we're moving from Bellevue Park to the square.
Wow.
So we hope to have more exposure as a result of that.
Well, you will definitely be back. We're going to do this every month, same bat time, same bat channel.
Well,
so we'll get you back, and when you have when we have more time to talk, and we'll hit it hard.
thank you for the opportunity. I appreciate it.
Thank you, Dana. Herb, before we wrap up, another member of Team St. Clair, Patricia Rettig, who was a long time viewer of our briefing every day during COVID. She passed away. Patricia was from Fairview Heights. Many of our people that viewed this remember that she would always say Fairview here. She passed away, and it makes us sad that we lose a member of the family, and so we just want to send our condolences to Patricia's family and friends, and certainly to everyone in Team St. Clair. She meant a lot to us.
Well, I think what it showed, and when you talk about anything that came out of what we went through for 2 years, having people like Dana on Team St. Clair, the times that he came on and talked about the profession that is really important to all of us. I think that Team St. Clair was built, and when you have citizens that joined in, like Patricia, people like that, and when you lose one of them, it's always rough, like you said, and that's kind of why we're wanting to keep the county residents informed of what's going on. Even though the pandemic, where we are now, we still have work to be done, and we're going to keep people informed. It's good to have people like Tammy, our interpreter, be able to come back and be with us on these monthly briefings that we're going to be doing, and we're going to be bringing more of those expert people in to talk about what it's like post-pandemic. And Chairman, before we get out of here tomorrow, we're going to have a fundraiser. Why don't you tell our viewers what's going on with that?
So on the steps of the courthouse, we'll be we're going to have hot dogs We're going to be making hot dogs, potato chips, water, $10 for lunch, and all proceeds will go to Ukraine.
Well, and as you see, we put up, we're going to have you can drive through. You can pull in through the square there at the county courthouse. There'll be some signs out there marking the entrance and exits, and we expect hopefully a big crowd to come out and support this because, just when you think people have got it rough, what's going on over in Ukraine is something that is affecting all of us. You may know somebody from there. You may have family. And as the chairman said, all these proceeds will go to help benefit that terrible thing that is going on over there. And that's going to be tomorrow right there at the Circle Drive at the courthouse. You walk up there. If you're out driving through Belleville, stop in, follow the signs, and get you a little lunch, make a donation, and we will appreciate that. As I said, we will be continuing these type of updates at least once a month unless something else comes up that we feel is important to share with the citizens of the county or wherever you may live at. But Dana, again, I want to thank you for being here today. It's really informative, and we'll definitely have you back on here.
Thank you, Herb.
So stop by tomorrow at the St. Clair County Courthouse and grab you some lunch, and then we'll be back here at a later date with some more information. Everybody have a good evening.